Okay, today we're going to learn how to load suture on a needle holder. Whenever I say the word suture, what comes to mind? Stitches. Very good, very good. A needle, this is called a needle holder. We also call it a needle driver. A needle holder holds the needle and it drives or inserts the needle into the tissue. And when we're talking about the tissue, it's from a wound. Now, a wound can be from a car wreck, like a jagged thing, or we also refer to an incisional wound, an incisional cut as a wound. So when we say the word wound, it doesn't mean a sore. It means an injury that we're going to. So when you do stitches, what are you trying to do? What do you think the goal of stitches is?
To heal up, to put back together what you tore apart so it doesn't get infected.
Perfect. Perfect for wound healing, right?
Yes.
Right. And then we hopefully, as surgical techs, we're going to prevent infection.
Right.
So here's the correct way to hold a needle driver. And what's the other word for this instrument?
Needle holder.
Needle holder. Very good. Okay. So you use your thumb and your ring finger. This index finger provides stability and control. So I'm going to pass this around, and I want you, and Jared, you're my lefty, right? Now, just because he's left-handed, do you guys think that there's going to be doctors out there that are left-handed?
Yes.
So you're going to have to learn how to load suture left-handed. Now, Jared, you're going to be at a disadvantage because most of the surgeries are for right-handed people. It's usually more difficult for right-handed people to learn how to load the suture left-handed. So you're really at an advantage. A lot of times left-handed, you guys have the raw end of the deal, right? All right, so I want you to practice what I just told you and then pass it around. Put it in your finger. Get comfortable. Yeah, perfect. Okay. Get comfortable with just feeling the instrument.
Oh gosh.
All right, and Tommy, you did really good just then because these are ratchets. When we load suture, we always click it to 1. Okay, so you felt how that is. This feels unnatural at first, but after a while, after we practice, it's going to, and here's how you actually pass an instrument. All right, here's the hand that he wants. Now practice in your hand with the right in the rings. How does that feel?
It doesn't feel wrong.
Doesn't feel wrong? All right. So let me show you. I'm going to show you. I'm going to let you guys practice holding the instrument just to get comfortable with it. The first thing you do, and on your handout, we have step-by-step guides of what to do. The first thing we do is we look at our suture. And suture is just a fancy name for needle and thread, okay? Needle and thread, but we call it suture. And so the first thing you do is you open the package.
I have a question.
Yes.
Are we supposed to have gloves on? Like,
perfect. That's a good question. You will have gloves on. You will be in the sterile field. Okay. And I'll teach you. And when it's in this package, this is sterile. This means it's sterile when it's in this package. When you see it out like this, it's not sterile anymore. We're just using these for practice.
Right.
Very good question. Thank you. All right. So how to load suture is you open the package and you look here. It's already, the way that you see the picture here, it's already in there. You get your needle driver and you clamp it on one, and there it is. Okay. So then you adjust it. You load it at a 90-degree angle at the lower 1/3. We'll get into needle time. I'm going to let you guys practice. So pick your suture, and while one person is working on this, when you think of loading suture, what kind of problems do you think would come up? Just if you're loading suture and they're in a hurry.
Not getting it in there.
Say again?
The tangles.
The tangles, that's good, and I'll teach you how to do that. But yes, the tangles are an issue.
And not being in there good.
Not being in there good, but think about something else. That's a pretty sharp end.
Yeah.
So this is an opportunity to be, if you aren't steady and if you haven't practiced enough loading, you can stick yourself or someone else. So that's a healthcare puncture.
And that can spread diseases.
Spread diseases, yes, because this is a cleaning needle. But do you think that we use the whole thing in surgery?
Sometimes maybe.
We try to, because these are very expensive. So you'll use the suture, and they'll pass it back to you, and it'll be bloody. It'll be so you can get contaminated. You can contaminate the patient, and you can contaminate yourself. All right. So now we're going to try yourselves to load the suture. Jerry, I'm going to let you go first. There you are.
It
Right.
doesn't matter which one I use.
It doesn't matter. But what do you guys notice? I had you looking at the sutures. Did you notice anything about them at all?
That the bigger the number, the smaller the needle
Very good, Journey. That's very good. She said the bigger the number is right here, the smaller the needle. So if you guys want to, get one about like this. That's a bigger needle, like a 2-0. I'd use that one, or let's just use this one and practice on it because they're bigger. That is a very good observation. And it's just opposite of what, pardon me, did you help him? Okay, thank you. So, let's practice. All right, Jared, good. You've got it open. And watch Jared so you guys can help each other. And take it all the way out of the package. Take it all the way out of this outer package. Yes. And you can hold that. You can hold it in your hand. Very good.
Pull it out like
Just
that.
pull it out, but watch, yeah, and yes, and you can pull it all the way out.
Gosh.
And for right now, don't worry about the end of it and where it's going to go. All right, now, angle it at a 90-degree angle. And try to use, just one, you have to use one hand. And guys, this is going to feel uncomfortable for a while. It really is. Now, while you're new at it, I'm going to show you how to do it so you don't stick yourself, okay? And your hands are really big, and a lot of doctors are, especially in like ortho. So there's all different sizes of needle drivers. I just have this little one available. So you release the ratchet by holding your needle and readjust it. Now, you want to have your needle facing towards the surgeon. When you pass it to them, it'll be towards the surgeon. Okay, so we'll worry about that later, but you have it exactly right. So try to adjust it yourself carefully. Journey, yes.
So I unclamp it to move it.
Yes, but try to grab it from here, avoiding the end of it. Very good. And you got it. Perfect. Perfect. Very good. All right, now try to put it back in your package. Actually, that's a bad technique. There we go. I'll take that from you. And you guys are going to get so good. Some surgeries there's over 100 needles, and you count them 3 times for the surgery, and you can load them so fast.
Really?
But right now it just feels really uncomfortable.
Weird.
Yeah, it feels weird. Very good. So while she's opening that, I want to show you the parts. The rings, the tip. It's dull, so whatever it comes into contact with, it will not damage. We're trying to prevent and use the instruments that will prevent the least amount of trauma, and that's damage. So go ahead and you guys practice. We're real informal here, so if you have any questions, just shout it out. You guys have done a really good job today.
Wow,
Very
that's
good.
longer.
That is longer.
The littler the needle is, the longer the thread is? Or
No,
the bigger
that's very good. The length of the thread is on here. It says 27 inches. It just depends on the package and what the doctor wants.
Oh, okay.
So Tommy, it's your turn to practice.
Okay, here we go.
All right, and let's just wrap up for today. We're out of time. You guys have done a really great job. Do y'all have any questions? Any at all?
Whenever like you do this for real, like what do you do with the paper like right after you open it?
Oh, that's a very good question. All right, so you before the surgery starts, you go in and get whatever sutures the doctor wants. This will be draped in a blue. Anything blue means sterile. You've seen the blue on TV. So what you do, here's what you do. You open. This is I'll be standing out here, and this is how you. The non-sterile person, you're scrubbed in. You're in blue. You're in your. And here's how they. And so it's going to be on your back table. We'll go over that later. This is a very good question. I can tell you're ready to get in surgery, aren't you? Isn't that exciting? But it'll be on your back table, and then you'll load it up on what we call a Mayo stand. So this package, the bad package, you could tell that you didn't want it on a sterile. You knew it was going to have germs, right? So that the nurse gets the circulator gets rid of it, and it's sterile on your field to use. Very good. Very good. Thank you so much.